Hi, and welcome to the Future of Dermatology podcast. I'm your host, Dr. Farah Kamangar, board certified dermatologist. We are here to talk about anything and everything dermatology related. You'll hear from me and my guests who are dermatologists, physicians, experts, scientists, residents, and medical students in the field of dermatology. We publish weekly, so if you like what you hear, hit that subscribe button and show us some love, and thank you for joining us.
Hi, welcome back. Today we have a very exciting guest. We have Dr. Serena Elmariah from UCSF, and she is just amazing. She's given talks before at SF Derm at a virtual conference and at a conference in Napa last year, and her talks are just so riveting. She is not only an MD, but also a PhD, and also has a Master's of Public Health. Got lots of degrees in throughout the years. She's an associate professor of dermatology at University of California, San Francisco, and the director at the UCSF Center of Itch and Neurosensory Disorders. So she is the absolute expert on the forefront of the nervous system, immune system, and the skin and how they relate. And I'm so excited to have you here.
Thank you so much, Farah. It's so nice to be here. I'm really excited. I'm always excited to talk about itching or nerves or anything along those lines. But it's a particular pleasure to be here with you today.
It's so much fun. And then you guys are starting up a lot of really cool research, right? I'd love to, and it might be kind of early steps still, but I'd love to hear kind of the forefront. What kind of research is being set up now, or what questions are being looked at in with having to do with the nervous system and the skin and the holistic approach?
Yeah. Well, so as I mentioned, so many people have been trying to understand itch for decades, whether it's simply just to treat it, for our patients who struggle with it in so many different capacities. But now, itch has really, I think, become a tractable problem, which is great. And it is also emblematic of the fact that we're going after other sensations. So understanding, itch and pain and other aspects of dysesthesia. So that's one of the things that we're starting to really launch at UCSF. And there are multiple places, multiple universities and academic centers and academicians who are also very interested in this around the globe, really. So, it's a real pleasure to be part of this field. Another thing that I'm working on and that several of my colleagues at UCSF are interested in is not just dissecting out the sensory aspects of our skin, but really looking into the kind of neuroimmune connections and neuroepithelial connections, from a basic science, a translational, and a clinical capacity. So, at the center, we're trying to not only dissect out itch pathways and how you can invoke or induce and then amplify itch, and then therefore, how you can essentially shut it down when it's gone awry in various itching disorders, but also what that means for the nervous system and how the nervous system is now contributing to other cutaneous diseases through itch, but also beyond itch.
Yeah, it's so interesting because I think for so long we've known, and we ask patients in clinic, did you have stress before this, dermatitis started, and these kinds of questions. But some of the research you've talked about, and you had a really great talk on prurigo nodularis very recently about that there are literally just immune markers and cytokines affecting the nerves, right? Which is something that I don't know if it was like how long exactly we've known that, but to me it feels like much newer in the last few years that we're sort of talking about.
Yeah. Well, it's funny because I'd say as a neuroscientist, it's never surprising to me that there is an immune receptor, a cytokine, an interleukin receptor, that there are, multiple ways in which your nervous system is endowed with the ability to detect anything that's happening in your skin, whether it's an epithelial aberration, whether it's, again, just barrier disruption, and you're detecting actually, peptides and antigens that are on various microbes or on disrupted keratinocytes, or the alarmin cytokines that they actually release, versus just even, the many, like the multitude of factors, the overwhelming mind-numbing factors, right, that are released by your mast cells and your T cells and all these immune cells that are there to convey what's going on in the environment, right? Because your nervous system is only there, right, to actually be a sensor for these things and then to figure out how to coordinate them. And so, again, I come from the perspective where, of course, your nerves are going to have, cytokine receptors on them. As a field in dermatology, right, we're a field of immunologists and epithelial biologists. So it sometimes, I think, comes from as a surprise, because you think all of that discourse, right, is really only the domain of the immune system and potentially the epithelial cells, if you want to give them that credit, right? As we've seen bear out with countless diseases like atopic dermatitis, psoriasis, and many others. But when you start to bring in the nervous system, people, they're like, oh, that's surprising. But really, is it?
That's true. From a neuroscientist, you're like, no, this is how we see the world, from the nerves first. And we talked last at our last Progynodularis talk that we were having. I asked you a bunch of questions about the fibroblasts as well. Is one thing I think is just so interesting is also just, of course, we know aging skin becomes super itchy for a lot of people. So whether that's the immunosenescence, the immune system going out of whack and aging, then affecting the nerves, or our nerves just getting older and misfiring. I'd love to kind of hear your thoughts on sort of that aging skin itch too. I know that's probably a really broad and big topic, but it's sort of like what happens is why do we all get itchy as we age?
Yeah, well, I think you kind of hit the nail on the head when you identify that it's such a broad topic, because there are so many aspects of aging skin that can contribute to this really fundamental sense of itch, which again, I liken the sense of itch to being just an informative pathway to your body to recognize that there are potentially multiple fail safes that are now, failing, right? So I would say that there can be epithelial dysfunction, right? Like that barrier dysfunction is accelerating as you age, as you're losing natural moisturizing factors, like the lipid balance, the ceramide balance, all of that is a bit off, but you're also beginning again with that breach of the barrier to release those alarmin cytokines, which can directly activate these itch sensors, proreceptors in your skin. We also know about immunosenescence, right? This type 2 shift in the immune profile, where all of a sudden you may be getting more recruitment of T cells or mast cells or even basophil, kind of presence, eosinophils, all of this, where you're, all of the factors or many of the factors that could be stimulating itch. And I use factors as a general term because each one of these is releasing cytokines or other, peritogens, itch inducers that can be contributing to itch. Then there's always this issue of polypharmacy, which I know is external, but this idea that you can either impact the ability of your nerves to sense itch, but are potentially even giving them an onslaught or exposure to things that are disrupting the barrier further, as we know, with like statins or other drugs that could be influencing even just how those nerves signal, let alone the barrier that could be, influenced, so that you're getting more compromise and then engaging itch. And then finally, as you said, like the aging nervous system itself, becomes susceptible not only to more itch, but also more pain and more sensory dysfunction. And so that is something that, we're only on the cusp of understanding, but seeing where you could actually promote itch or abnormal sensation along any one of those lines is, again, it becomes a challenge in and of itself, when you're trying to manage older, kind of itchy or aging itchy patients.
Yeah, that's actually so interesting seeing it from a neuroscientist standpoint, where you're like, the itch is kind of a signal. It's almost like when your car is giving you that check engine light. Because a lot of times you can kind of just focus on the itch and you're like, okay, let's treat that itch, give you medicines that block the itch. But it's sort of like, are you going to the mechanic and they just turn off the check engine light without fixing whatever triggered it?
Well, that's actually a topic. That could be a podcast, a show in and of itself.
Yeah.
One of the questions I get very frequently, whether it's a patient with prurigo nodularis or even just chronic itch, and it's not a clear inflammatory trigger, right? Like not just the contact dermatitis or, a known trigger for this patient, but a concern where could there be a cancer, right? Could this be perineoplastic or, a malignancy induced itch, because your nervous system really is a sensor. It is that, check engine light. And, it's one of those things where we usually say in the itch field, various experts get together and we talk about this. When are you really suspicious, right? So obviously in the setting of, a good review of systems, which you do for every patient with chronic itching, we try to identify where are other, kind of risk factors there. Is the patient losing weight? Do they have fevers, other B symptoms, things along those lines, even other atypical manifestations that could be a concern. But really we think of itch, being invoked in the setting of malignancy when it's about a year or less, right? Sometimes it's even less than a year, but 3 months, 6 months, acute onset of very, very severe refractory itch. And you start to think about malignancy beyond a year. If somebody's now struggled for 3, 4, or 5 years, it doesn't mean they couldn't have some phenomenon, certainly, that is potentially, perineoplastic, but in general, it's not as much of an alarm bell because of the fact that there's so many factors that could be feeding into itch. It still could be immune dysregulation, right, without actually being perineoplastic. And so, that's the thing we all kind of want to rule out, but how you rule in, what are the, 999 other things that could be triggering itch in the aging nervous system I think it's I should say in the setting of aging is really is more of a challenge. So age-associated itch really is it's the perfect way to start to understand all the many factors of how the nervous system is working with the, keratinocytes, the epithelial barrier, the, and the immune system, or even in this case, you brought up prurigo nodularis and the fibroblasts, they're another really critical, particularly in prurigo nodularis, another really critical cell type that leads to the evolution of that disease and can be affected by pruritogens, but also can elaborate pruritogens that exacerbate, or so we suspect. We're in the process of figuring this out, but, how does that work together where you're also, the fibroblasts are actually contributing to the itch, the nerves are contributing to the fibroblast, the nodular formation. It's really, it's really fascinating. And then how the immune system ties all of that together. So each one of these conditions, right? Whether you're talking about age-associated itch, which is a huge basket, prurigo nodularis, all of that, how they contribute to our understanding of this really primary sensation is, it's just been a fascinating journey so far.
That's amazing to hear. And I kind of, whenever I think about like, how do we fix stuff like this, right? One of it is finding out what the causes are, but then how we fix, how we prevent. The epithelial part, I feel like we have it kind of down. Not that everybody does it. We're like, moisturize a lot. These are some good moisturizers, avoid the sun, try to not have as much breakdown of your collagen and skin thinning and all the things. And then there's the whole anti-aging world, the cosmetic world that's really flourished because there's kind of a business around that and that's what people want. So we kind of know different ways to create more collagen, maybe get your fibroblasts to wake up a little bit and kind of get fresher, maybe rejuvenate the top layer of the skin a bit. So maybe it's looking better, but of course there's also the aspect of the function. And then when you go deeper than that, do we kind of have any ways to like rejuvenate our nerves? Are we, other than just Botox and just knock them out completely, but like what other modalities do we have? Because I feel like as dermatologists, we're kind of going outward in, and I'm like, to the extent of my knowledge, I can think of, all right, let's put some Retin-A on, maybe get, some of the collagen turning over, fix the ECM. Like what other things can be done to try to prevent this kind of, and not necessarily the itch in the aging, but I'm using that as like a proxy for just things
Yeah,
getting
well,
a
I mean,
little
that's
less
a
functional
huge
over
question.
time.
If you could figure out, how to prevent the aging of the nervous system, you'd solve a
Yeah.
handful
Is there
of
anything
disorders
there?
right there.
Yeah,
I mean, even
right.
outside of the skin, obviously. But
Yeah.
it actually is a really good and a really important question that I wish I had a better answer for.
Mhm.
We know that when you're thinking about primary neurologic disorders, right, that even if you're thinking something is totally different, from
Yeah.
itch as like Alzheimer disease, cognitive
Yes.
disorders, dementia, all that. We know that, rest, sleep, the ability of nerves to repair, even with diabetic neuropathy, thinking about, how to promote healthy metabolism of nerves. Those are things that are obviously outside of dermatology that many, many people are working on. And
Yeah.
that idea of like just the natural senescence of the nervous system and how to prevent that, I think is, a whole field onto itself. One thing I think you highlight that is really important is that I do actually believe, so this is just my personal feeling, is that when you take neuroprotective measures, you actually are likely influencing the health of your skin. And it's that concept of this dialogue between the nervous system and the skin. So like the bulk of the skin, I mean, the immune system, the epithelial cells, the fibroblasts, just that crosstalk alone, I think is something that ends up, being beneficial for you overall, because we see it's things like sleep, right? If you don't sleep well, you can see it in your skin, right? If you're really
Yeah.
stressed out, you can see that in your skin. You can also see how that affects your overall, activity and your even, your memory and just your general function. And that is reflected in your skin. We often think of, even like when people get more flushing disorders and things along those lines. I mean, there's a clear neurovascular component to
Yes.
that.
Yep.
So it's this idea that it's not just a monologue where something's going wrong in your skin and then feeding these senses to your nervous system. It's really a dialogue, right? Where your nervous
Yeah.
system is also influencing the health of your skin, and the skin is influencing the health of your nervous system, in some capacity. So it's a concept it's still yet to really be defined and defined well, but there's no doubt, right, that plays a role. Sleeping well, exercising, doing those types of things that are good for your overall metabolism and your brain health really ends up being pretty good for your skin health too, when we look at it across the board. So,
That's an important kind of paradigm shift for us because we're so easy to say just moisturize, sunscreen, but you're right. All the neuroprotection, we have to kind of incorporate that as well. What do you think of alcohol as a neuroscientist? Is that like a little is okay? Don't have any.
well, I
Like
mean,
I was just thinking about that in terms of like our rosacea patients and the vasoactive and
yeah, I
um,
mean, it's a really good question. Obviously, as I manage a lot of patients who have neurogenic rosacea, a lot of flushing, but even just
yep.
kind of your standard, or erythema telangiectatic or like papulopustular rosacea patients, they definitely flare a bit, but it's not obviously going to just be alcohol, right? So it's anything
Yeah.
that's going to cause that acute vasodilation. For those patients where it's limited and it doesn't, they don't have these long persistent flares, I usually tell them be aware of it as a trigger for yourself, and anything that perpetually triggers you, if that really starts to elaborate that cycle, then it may be something you want to pull back on. And that's true, right, of anything that we'll counsel on for, rosacea, whether it's true neurogenic rosacea or not. But, we'll say like, stay out of the sun, obviously, right? You're
Right.
allowing for that vascular proliferation when you're getting that additional sun damage. And I think the same is true for alcohol, and even for, for those people where spicy food really is their trigger, or
Yeah.
perpetual stress, which, does actually inherently cause you to flush a little bit, can be, factors that you have to take into account. And when you do, I think patients not only acutely feel better, but they notice that over time they're less prone to even flares when they're not exposed to those specific triggers. So, you have to tailor it obviously to the patient, but I don't think there's anything that's all evil or all, or
Yeah,
all
there's just
protective.
so many things, but it's important for us to kind of start thinking about that, adding the neuroprotection advice to, because there's probably so many of our disorders we can think of where, you have that piece as well, where
Well,
if you preserve the nerves, you can probably, the skin will look better.
yes.
as
Well,
well.
it's one of those cases where we don't have enough data to
Yeah.
realistically be able to counsel patients effectively, or with, yet with sufficient data. But for my patients who are, in that pre-diabetic stage, and there's clear kind of glucose dysmetabolism that could be affecting the health of their nerves, it's, I'll counsel them for the merits, just for the merits of getting kind of their blood sugar or their hemoglobin A1C, kind of under control. But very often they will ask me, they're like, will this help my skin in some way? And I'm always marveling that sometimes, our patients often have a lot of insight into the role that these factors, whether it's getting their blood sugar under control, whether that's because of, getting their nerves under control, and how their nerves might affect their skin or their flushing or how it feels, often they know this, and they remind us of this every day, but that's one area where there's not a sufficient amount of data for me to say, if you actually can lower your hemoglobin A1C, you're not only going to make it less likely that you get a true diagnosis of diabetes, which that we know, but that will then be beneficial to your skin. But I will say that over time, I do find that those patients who can take those efforts really, I believe, do themselves a service when it comes to how your nerves ultimately can, impact their sensory biology in their skin, and therefore likely, impact even just how their skin functions over time.
Yeah, no, that's fantastic. So definitely just eat better, sleep well, keep the sugar down.
Right.
I
If
did
we
have
can all
one,
do that.
if we could just do all the right things. I just have one last question. And then actually our very, very last question, we always ask what you're most excited about for the future of dermatology, since it's the Future of Dermatology podcast. But while you're thinking of that, I did see, this was, I think, from a while ago, on the cryolipolysis lasers. I think there was like a really cool paper I saw that you had co-authored on the, just basically that the dysesthesia that you get after potential procedure, like the cryolipolysis on the belly or wherever you do one of those procedures, and that kind of perceived nerve, I won't call it nerve damage, but you probably have a better term for it. But there's
right, where there's
that
a kind of a
sensation.
proliferative effect and impact on the
Yeah.
nerve that will lead to an alteration in sensory function. And for most people, it's
So
actually it's pretty transient, but that was a phenomenon that's, obviously been observed within the, the patients who are undergoing, cryolipolysis for cosmetic reasons. They were having these sensory phenomenon. And then, a brilliant colleague of mine, Dr. Lilith Garibian, has really taken that observation and built upon it, because we've used cryo directed techniques to affect sensory biology for quite some time, but she's really the one who's now spearheaded, this idea of trying to use that specific phenomenon to actually manage sensory phenomenon, primarily pain. And we can obviously try to take advantage of that for itch as well and other dysesthesia, but that is, again, just a field that I think will really blossom and grow. And so, even in the field, again, kind of taking this back to itch, there's so many ways that we're trying to target the immune system, the nervous system directly. And thinking of it not only through drugs, right, through medications that we can give, but even through these other techniques and treatments that we can use. Again, it's a tried and true observation for millennia, right? That you can use ice to numb pain or itch, right?
Well,
Every
so
patient has used an ice cube
and
or
I was
an
going
ice
to ask
pack.
that's exactly what I was going to ask you next, is what are your thoughts about people are just doing all sorts of things to cool down and do like the deliberate cold exposure, where they're doing like these really long, just jump into super cold water, or the ice baths, or you go to these centers where they have like the full body cryo things you go into. I mean, they're probably not getting maybe as cold as, I'm guessing, as the cryolipolysis, to the point where it's affecting your nerves. But is there anything in that, and it could be theoretical, where there could be some benefit in that for your skin, like these like extreme cold plunges that people are like, it's more of a fad now, but of course some groups have been doing that forever, like these in certain parts of the world where they go for these super long cold swims, and but like at extremely low temperatures, not just like your average.
Yeah, it's so there, I think there's more, kind of just non-commercial, if you will, or maybe commercial. I guess that's the right word to describe it. There may be more commercial interest in using those types of strategies for multiple purposes, right? Of cooling down inflammation and alleviating joint pain and itch and various, sensory phenomenon in general, whether it's your skin or not. Also, the vasoconstriction actually can cause for a brief period of time. People, it can make people feel, less flushed. The one thing actually to the counter that I caution people is, as I've seen many patients, because I manage itchy patients all the time, I will frequently be the one to say, take a cold t-shirt, put it in the refrigerator, put it on if you're really, really uncomfortable, use cold to your benefit. There are limits to that, because when you're actually using, aggressive cold, it can actually trigger a stress response, in many people, where they'll actually get this rebound phenomenon. And so you have to be a little bit careful of that. For the average patient who's doing it for kind of maybe other just health benefits, who doesn't necessarily have any skin issues, I don't know that it's necessarily a real problem. But I've had a lot of patients come in where they've done things like that, and where it was total body intense cold exposure, where they ended up having more of a rebound phenomenon that actually made them worse. So if you're just for, the sake of, if you're advising that for patients with itch, be careful with that one. Be ready to answer some phone calls.
So don't do that. Yeah, that's right. They could have lovely flare. And our last question, we always ask, what are you most excited about in the future of dermatology, and as it pertains to all the wonderful work you're doing?
Oh gosh. I mean, I don't know. I'm excited about dermatology every day, because I think there's so many amazing things that are happening. In my wheelhouse, I really am looking forward to having a handful. I mean, I'm just so happy to say it, a handful of new agents, in the pipeline that are being directed towards this purpose of alleviating itch, regardless of whether it's inflammatory, neuropathic, or, other aspects of itch. And as I said, even just for our own research, starting to figure out, how we use itch, as a barometer for other neurologic diseases, and how we can use actually the skin as a window into understanding aspects of the aging or diseased nervous system. The one other thing that I'll even say along, those lines is just this appreciation that there is this connection between your skin, your gut, and your lung that we've all known for so long. But the fact that that's now being, I think, investigated and appreciated across specialties, coming back to this fact, the idea that we're so siloed in medicine, and coming out of our silos to recognize something that our bodies and many people have known about their own bodies for some time, is one of the things I'm most excited about.
Absolutely. And research seems to be a lot more cross sites too, right? Cross specialties, cross sites. Like, it just seems to be so much more collaborative. Just research in general, sharing knowledge, which is really exciting.
Yeah, it is. And we recognize kind of the similarities. Obviously we're dermatologists, we focus on the skin, but knowing that GI doctors, thinking about the gut epithelia, they're working out similar pathways. Pulmonologists and immunologists looking at the lung, they're figuring out similar pathways. And then knowing that there are multiple ways that those three epithelial barriers can interact, right? So the fact that you can be releasing cytokines, and that there can be, obviously the cellular traffic that's there, but now recognizing, oh, wow, the microbiome is also playing a role. The nervous system, can be signaling between these different barriers and influencing how one experiences any one particular aspect of a disease, or kind of across diseases. And so I think that that's just, it's exciting to see, and knowing how much more we have to know. I actually love that. So it's amazing.
Those are the fun parts. I'm so excited to start looking at some of the data that's coming out from all the research that you're doing. It's just, it's fantastic. But thank you so much for taking the time and joining us. We always learn so much from you. So thank you for your continuous support of SF Derm and teaching all of us all
Oh,
the
yeah, of
amazing
course.
things
I
you're
appreciate
doing.
it. Thank you again for having me.
Thank you for listening to the Future of Dermatology podcast. Remember to hit that subscribe button and share the podcast with your friends. The more you share and subscribe, the more we'll be able to grow and share our dermatology knowledge. If you have burning dermatology questions, feel free to leave them in the comment below, and we would love to address them in a future episode. And please note that this podcast is not intended to substitute for medical advice from your doctor.